And on Light 92.1, we're visiting this morning with Dr. James Nitzkorski. Dr. Nitzkorski, good to have you with us.
Thanks for having me.
We're talking about skin cancer today. Let's start at the beginning and find out, how can we reduce our risk of getting skin cancer?
Well, there are several different types of skin cancer, and as a surgeon, I primarily focus on melanoma. It's the deadliest of all skin cancers, and it comes from the sun. So any way we have to reduce our exposure to the sun, we can reduce our risk of melanoma.
Sunscreen, for example?
Sunscreen is so important. Covering your skin to whatever extent possible. The worst hours to be outside are from about 10 o'clock in the morning until about 2 o'clock in the afternoon. The sun rays are strongest during those periods of time. Even on a cloudy day, the sun rays can go through the clouds and hit your skin. So wearing sunblock, SPF 15 at minimum, can be one way to prevent melanoma. You know, as I mentioned, covering your skin, wearing a hat to whatever extent possible. These are ways we can reduce our exposure to the sun rays.
Now, what about the sun worshiper looking for that deep, rich tan?
Not a good idea.
Not a good idea.
You get one set of skin for your entire life. And aside the issues of premature aging of your skin, cancer is just so important to avoid. It's preventable. Now, it's interesting to know that sun rays are categorized as a carcinogen, much as the way as tobacco smoke is.
I didn't know that.
And nicotine is categorized as a carcinogen. It's a level 1 carcinogen, which means we know without a doubt that it causes cancer. So sun rays are categorized exactly the same way as, say, arsenic and plutonium, believe it or not. They're all categorized as a category 1 carcinogen.
When you put it that way, it sounds completely different.
Yeah, it's scary. A melanoma as thick as 4 millimeters could result in a pretty quick death. So it's so important to prevent these moles.
Now, we've got everybody thinking about that now. What are we looking for now on our skin?
So we want to look, we call them the ABCDs of skin awareness. Okay, so the first is A for asymmetry. If you could cut a line in the mole, if one side looks very similar to the other side, it's more likely to be benign. If it's asymmetric, you want to call your doctor. The borders for B should be very regular. If you have an irregular border, that could indicate that this mole could be a little more serious, so you need to call your doctor. The color, the C of the ABCDs is important. If you have one uniform color, it's more likely to be benign. But if you look at the mole and there are slight discolorations, different types of color within the mole, that's more concerning, and you need to call your doctor. And the diameter. So if it's bigger than, say, a pencil eraser, you need to call your doctor. Okay, so those are the ABCDs. Any one of those signs should prompt a call to your doctor to get a skin check. And, of course, anything that's changing, something's bleeding, if it hurts, if it itches, you should call.
So this is something we should all do ourselves on a regular basis.
Absolutely. I recommend every couple months doing a skin check. Your whole body needs to be examined. We always think about breast exams in women, testicular exams in men, but this is something that's equally, if not more important to do. It's so easy to do. It doesn't cost anything. And if there's anything that surprises you, anything that's curious, call your doctor.
Now, what happens if you're diagnosed with cancer?
Well, melanoma diagnosis can be a scary thing, and the most important thing to know for a new diagnosis of melanoma is that we have a care team already in place. Now, care typically begins with a dermatologist that will do an initial biopsy. If the biopsy demonstrates melanoma, it needs to be excised, and we excise the lesion, and we can do special techniques called sentinel lymph node biopsies to see if the cancer spread from the primary tumor site itself to lymph nodes. After the surgical therapy is complete, depending on the staging, sometimes chemotherapy is recommended.
Tell us a little bit about, Doctor, if you would, about your specialty and why it's important you're here in the Hudson Valley now.
So I'm a surgical oncologist. It's a pretty unusual specialty. There are about 1,000 or so surgeons that are trained every year in America, and about 40 to 50 surgeons go on to become specialists in the treatment of cancer. There are only about 15 or so hospitals in the United States that offer formal surgical oncology training. So while a lot of surgeons operate on cancer and they do a fine job, not many surgeons are specialized in the comprehensive management of somebody with cancer. So as a specialist in cancer, I think beyond just the operation, I think about the staging. I think about ways to incorporate other therapies if necessary. It's just a much more comprehensive view of somebody with cancer.
It's a special calling for you, isn't it?
Yeah, absolutely.
What got you involved in this initially?
Well, in medical school, I was interested in surgery pretty early on because not every specialty in medicine can offer such a quick fix for a problem. As a surgeon, I can make people feel better quickly for a problem. Certainly, removing a cancer, there's nothing better in the world than taking a cancer off of somebody's skin or out of their body. But I have, everybody, like most people in my family have been sick with cancer, and certainly has ignited a passion inside of me to take care of cancer as a real specialist.
I always find the word passion so important.
Yeah.
Doctor, final word for the folks listening this morning.
Well, I think melanoma is important because it can be prevented. So please reduce your sun exposure. Tanning beds should not be used. If you're going to be out in the sun, wear SPF 15, okay? Wear hats, wear long sleeves if appropriate. I'm not saying to avoid the sun completely. You don't have to spend your life inside, wearing snowsuits in the middle of July. We want everybody out there enjoying the weather, but, between those hours of 10 and 2 and on particularly sunny days, you should take extra precaution and wear that sunblock.
Doctor, thank you very much for being with us today.
Thanks for having me.